Great. Well, welcome, everyone. I'm excited for you to join us on our community health solutions. And the focus today is delivering on the promise of digital, how California is expanding youth mental health access at scale. So, welcome. So, just a bit before we dive into the topic, my name is Sue Grinnell, and I'm the director of the Population Health Innovation Lab. And we are a program at the Public Health Institute. And our mission is to create opportunities to experiment, share learning, and lead lasting change. Our focus is on collaborative partnerships, and in particular, partnerships that are focused around issues of health. Most recently, probably over the last 6 years, we've really leaned into rural areas and supported collaborative partnerships there, and in particular, behavioral health, with a focus on children, youth, and families. And we recognize like doing this work in communities is very, very hard. It can be isolating and can be really lonely and complex. And so we really are about providing opportunities for communities and change makers to help to navigate those challenges and really looking at what are the equity centered solutions and strengthening systems. So we do a lot of training, learning cohorts, and technical assistance. And we try to have fun. Fun is always good. So next slide. So this, where we're at today, Community Health Solutions, is actually an idea that I cooked up about 10 years ago when I very first started at PHI and came to PHI from governmental public health and moved to the Bay Area to take the job at PHI and started really immersing myself in a startup world. And I began to really pay attention to the fact that the way my experience, maybe not some of you, in public health is very, we plan, then we do, and maybe it works and maybe it doesn't. And so just began really like looking at how people are approaching problems. And for me, right, it's really important that we experiment and we really understand the pain points of what people are experiencing. Because if we create a solution and we think it's all that and then it doesn't work, right, it's always usually about them and not about us. So I think it's important for us to create opportunities to show solutions that have been based on the reality of what people are experiencing. So this is really just an opportunity for us to share solutions that are out there and what they're doing. And so, this is an approach, right, that we want to share with you, and hopefully will inspire you to think a little bit differently in how you're approaching your work. And so today, I'm excited because we are here with Dr. Tully. Dr. Tully is a Harvard-trained clinical psychologist and vice president of partnerships and integrations at Kooth Digital Health. They lead the statewide rollout of Soluna, providing free digital mental health support to Californians ages 13 to 25 and work to embed it sustainably within education, healthcare, and community systems. Over 18 years, Dr. Tully has designed and deployed digital health tools directed at large-scale training programs and influenced state policy in behavioral health. Their leadership spans academia, startups, healthcare systems, bridging clinical governance and digital innovation, and population health strategies to expand access to care. And with that, I'm going to turn it over to Dr. Tully.
Thank you so much for that kind introduction. Um, I'm very excited to be here and so excited to see as many people as we have joining us. Thank you for giving us some of your valuable time. And hopefully today I shall keep you entertained. So, as Sue so kindly introduced, I'll be here to talk about delivering on the promise of digital and really spotlighting how California is using a digital strategy to expand youth mental health access at scale at a population level. And I'm going to be talking about the program that California has invested in, which is Soluna. And this is Space Bunny shown here. This is Soluna's mascot, co-designed with young people who use Soluna. And I'll be talking a little bit about how it's been developed, what the data is showing, and how you might choose to integrate it into the work that you're doing if you are working with youth and young adults. So I always like to start by reminding us of the scale of the problem that we're working on. And I've picked two data points here, but I think everybody on this call is probably very familiar with the challenges that we're seeing in youth mental health. We know that 1 in 5 youth ages 13 to 18 live with a mental health condition. We know that young adults 18 to 25 have the highest rates of mental illness and mental health challenges of any age group with 33%, that's 1 in 3, reporting some form of mental health challenge or mental illness in the past year. That was data from 2023. And we know from more recent data that this has continued to rise. We have, to put it bluntly, a youth mental health crisis on our hands, and we need innovative solutions to address it. And it's going to be a multi-channel, multi-domain, multi-sector solution. And today we're going to be talking about the ways that digital spaces can be part of that. I think the other thing that's really important, and particularly so for the folks on this call, is the power of trusted messengers about the ways we can access help. We know that around 20% of adolescents in the US in that 12 to 17 range have a behavioral health condition, and that 55% of them say they're discussing it with their healthcare practitioners. So that's a trusted messenger, but also trusted folks in school settings, in community settings, trusted adults, trusted messengers that young people are spending time with, that they are talking with. Those are the folks that can help young people find the resources that they need. So we have a little quote here from a service user on Soluna that was referred by a school staff member. Soluna was actually recommended by my school mental health counselor, which was extremely helpful as I can't always see them. So that's an example of how the systems and those trusted messengers within the systems can help young people access care. And so part of why we do webinars like this and we talk to folks like you is to build give you additional tools in your toolbox as those trusted messengers so that you can support young people in accessing additional resources. Because we know that youth well-being is shaped by relationships, environments, access to support. And we know that schools and local health partners and folks like yourselves play a key role in creating those conditions. And we need spaces where conversations about relationships and safety and emotional well-being can happen confidentially and in ways that feel accessible and youth-centered. And I think we're realizing that this has to include both physical and online spaces. So thinking about traditional brick and mortar spaces where young people are, as well as online spaces, because young people are there too. And so how do we reach youth where they are and provide them safe, credible access to care and support that they learn about from trusted messengers in their community? And this is the mission that Kooth, which is the company that I work for, has been holding for the better part of the last 25 years. And it's really about creating mental health support that meets public healthcare needs, so population scale, that is a safe and credible space for young people to access the support that they need. I'm going to tell you a little bit about Kooth, the company. It was born at a kitchen table in the UK in 2001 with the idea of transforming youth mental health. And this sounds like an apocryphal story, but I did double check it with our CEO. And it was really the case that a counselor and an internet enthusiast were sitting around a kitchen table having a cup of tea, all very British. And they were sort of talking about, hey, we think this internet, we think it's going to be a big deal. We think young people might use it. We think this might be a good access point. Why don't we see if we can try to create a new space for young people to get help? And so that's how Kooth was born. And it started off as an anonymous email server. You anonymously email and you would get the support. And it has now grown to be a much richer platform and the number one digital mental health provider for UK youth. So we've got over 20 years of experience in this digital space. We started as a digital company. We have continued to build and learn and iterate on those spaces based on the science that we've done. And as a consequence, we've built something that is really youth centered, and the data show that it helps, that people feel better when they use it. And that's key. So, one of the things that I think is really important when we think about how to do public health initiatives and population scale access is, typically those kinds of projects are commissioned by or paid for by state government agencies, so by taxpayer dollars. And that's absolutely true in the UK, right? So in the UK, we have the national healthcare system. This is paid for by the taxpayer. It's a universal health access. And there are requirements in that healthcare system that any service that the NHS is providing has the data to back it up that it works. And so baked into the core values of Kooth is making sure that we are partnering with independent academics and researchers and thought leaders to evaluate and help us iterate and improve the platform that we're providing to young people. And so over the course of the 20 plus years that we've been operating as a company, we've partnered with over 10 academic research partners. We've published over 50 peer-reviewed publications and white papers, sort of thought leadership content. And that number is growing by the year, and we've got some really great research that's about to come out on the California project that I'm hoping you all will get a little alert about in the coming weeks. If you want to explore our research a bit more and understand how we've built what the service we provide, there's a hyperlink here on this slide that you'll have the slides after today, and you can click and explore and learn a bit more. What Kooth does is deliver early intervention and responsive support at a population-wide scale, and the focus is on prevention rather than cure. It's really about being upstream, getting young people the skills and support they need before they need it, so that we're not kind of waiting to fail, right? We're catching folks and giving them the support so that when life does inevitably throw a wrench in the works, they have support that they can fall back to, and they've already had access to skills that they have learned to be able to handle it. And the way we do this is we reach youth where they are, so in education spaces, healthcare spaces, and online, and we provide them early and responsive self-help, peer support, and professional support. So that includes self-guided resources, peer-to-peer support, so young person to young person. We provide coping tools, and we also provide professional support with coaches. And what this is then is it acts as a digital front door into other healthcare services. So we have care navigation team that can connect young people to community resources as well as crisis service if they need it. And so here collectively, the platforms that we design and have implemented internationally are providing these services to young people early on so that when they do need something, they already have it in their pocket. And our approach is really focused on providing evidence-based, rigorously governed support. So the platform that we've developed, the content that we're providing to young people, the framework, their journey to change, so to speak, is really rooted in person-centered and strengths-based approaches. We draw on evidence-based practices like self-determination theory and acceptance and commitment therapy. It's really about connecting, helping that young person connect to their core values as a person and the goals that they want to set themselves and how they get there. And it's really about them driving, having agency to do that. And all of this service that we provide is driven by rigorous clinical governance. So what this means, clinical governance, this is kind of clinical oversight on our practitioners. It's holding our practitioners accountable to a fidelity model that makes sure that no matter which practitioner a young person is matched with, they can be confident that they're going to get the same high quality level of care regardless. And the way we do this is conducting at least quarterly audits on practitioner sessions using our clinical model, our fidelity model, which is shown here on the right, I respond. And that ensures that we're maintaining a consistent high quality service that is scalable. And I can't emphasize enough how much of a differentiating factor this is in certain markets in the world, particularly in the US. So I'm a clinical psychologist. I'm licensed here in the US. During my training pre-licensure, I got a lot of supervision, I got a lot of feedback, I got a lot of clinical governance. But once I'd done my licensure exam and I got my license, I was essentially set free into the world of practice. And since then, no one has really come to make sure that I'm doing a good job. No one's really double checking that I'm creating high quality care consistently across the clients that I'm working with. We really haven't come up with a global fidelity model that we use in behavioral health here. And there's lots of good reasons for that. But I think that it has some disadvantages. And it means that as a consumer in the American behavioral health space, it's very hard to know if the practitioner that you end up working with is giving you high quality care. There's some really amazing practitioners out there, and there's some folks that maybe could do with some additional pointers and scaffolding. Having a fidelity model creates that scaffolding. And so, what we do in these audits with our practitioners is that we review the support that they're giving to young people on the platform to make sure that it is integrative, responsive, evidence based, safe, person focused, outcomes led, non judgmental, and data driven. And we're able to do this because we are a digital service. So, in a digital setting, we record our sessions, we have the transcripts of our sessions if they're chat based. And so we are able to review those sessions and evaluate how they stack up to the fidelity model as part of this clinical governance. So that's a real advantage of a digital space, is that you do have the ability to review the quality of care. And our practitioners love this because it gives them an opportunity to continue to hone their skills and continue to provide the care that they got into the field to provide, which is good quality care that helps people feel better. The model that our practitioners are doing this in is a goal focused single session style model. The service model is really about supporting young people in achieving the outcomes that matter to them and doing it in a high impact single session touch point. Single session doesn't mean one and done, it means one at a time. So young people can drop in for the session, the support that they need today. Maybe they'll come back in a couple of weeks for additional support on something else. Maybe they'll come back next week to follow up. They have lots of flexibility, but the design of the single session model is to give them the maximal support and impact in that single moment rather than requiring a commitment to multiple sessions in a row. Because when we've co-designed these platforms, young people tell us they want flexibility. They want the ability to drop in and get help in that moment that they need it, and then go off into the world and achieve what they want to achieve. Sometimes they want to have multiple, sometimes they want to just have one. So by designing the model around this single session intervention framework allows us to prioritize maximal impact in a single touch point. And I'll be showing you some data later that shows that this is effective in addressing young people's wants and needs when they come to us. So with all of that framework of what Kooth, how did Kooth become Kooth, and what is the service we provide, and what is the kind of clinical governance framework that service is scaffolded in. Now I want to tell you about Soluna, which is the American incarnation of Kooth services. And it is designed to help young people build critical skills for navigating life's challenges. Soluna is part of California's first in the nation initiative to transform youth access to behavioral and mental health support. We have been contracted with and are partnering with the state of California, the Department of Healthcare Services, to provide Soluna for free to every 13 to 25-year-old in the state. And those folks that fall in that age range and live in California can access Soluna via any internet-enabled device, so smartphone, tablet, or web. You just need an internet connection. It is designed on purpose to be super easy to access. There are no costs attached to the service user or the county or the health plan or the school. It's already been paid for at the state level. There's no insurance required. There's no documentation needed. There's no referrals needed. The only thing the young person needs to do is either go to our website and sign up via the web app, or go to the App Store and download the Soluna app and sign up there. When they sign up, they only need to provide us with three bits of information. They need a California zip code, they need a date of birth that falls in the age range of 13 to 25, and they need an email address. Once they've given us those three bits of information, their account is set up and they have access to all four of these pathways of support. And I'm going to go through each one from left to right. And we'll start off with the self-guided resources and calming activities, so coping skills. So these self-guided resources, the young person can explore at their leisure, finding the topics that they're interested in. Think informational articles, audio, video, quizzes, other formats of information on any topic, all the way from mental health topics like what does it feel like in my body to be anxious, through to sort of social development topics like how do I navigate social conflict, or how do I think about dating in the modern dating world, all the way through to do I want to go to community college, or understanding the experience of a first gen college student, to understanding how to navigate my finances as I grow up and develop into young adulthood. So it's not just about behavioral health topics, it's about all the topics, all the challenges that young people are navigating as they move through the world and move through adulthood. And then the calming activities, these are gold standard evidence-based coping skills that many of you will already be familiar with. So think breathing exercises and journaling and mood tracking and goal setting and a host of other tools. And they've all been designed to be engaging and easy to use so that they're there in your pocket if you need them. So that's the self-guided resources piece. The next source of support is our peer support. So this is our safe, moderated community forum where service users, young person to young person, can help each other. It's a space to share experiences, connect, create community, and ask for support. So the look and the feel of this is very familiar to us. It looks and feels similar to what you're used to seeing in other online forums like a Reddit, where you have a person who posts an original post and then other people respond in thread to that post. And so you create these different threads, these different conversations. But as we know, online spaces are not necessarily safe spaces. Traditionally, in like a Reddit forum, the moderation happens after the post. So a person will post something to the forum and then a moderator comes along and says, hey, you violated our community guidelines. This isn't a safe or savory post. I'm taking it down. Which is great, but it doesn't undo any harm done by the folks that saw that post before it was removed. So we've made a very simple shift in the order of operations to create a 100% safe space for young people. We've simply flipped the moderation order. So in Soluna, every post and every reply to every post is first moderated before it is published to the platform. And by making this simple flip, we are ensuring that there is no chance for any unsafe or unsavory content being posted to the forum, which means young people can trust and feel safe that in that forum, they're only going to see safe, supportive, non-judgmental, community-based discussions. All of our moderation is done by real humans. We're not using AI to do that moderation. And so real humans are reviewing it. And along with reviewing to make sure that it is, safe, unsavory, credible info, we're also using that moderation moment to capture any signs of risk quickly so that we can reach out to that young person. And I'll be talking a little more about safety in a little bit. Let's move on to our third source of support. This is our one-to-one behavioral health coaching with certified mental health professionals. And this is accessible via chat, so a bit like texting back and forth, but you're doing it inside the platform. You can also have a video appointment with your coach, or you can do it by a traditional phone call. And there's two ways that you can connect with a coach in Soluna. You can either drop in to the coaching queue, in which case you would be matched with the next available coach, or you can book an appointment ahead of time with a coach of your choice. Coaching is available from 10 a.m. to 10 p.m., 7 days a week. And coaching sessions run to about 45 minutes. So the last starting time for a coaching session is 9 p.m., just to give that service user the appropriate amount of time for their engagement. And the drop in versus the scheduling, it provides a lot of flexibility for that young person. You can drop in one day, you can book an appointment with a coach of your choice another day, you can book appointments with the same coach over time if you like that person and want to build a bit of a coaching relationship. Or you can book an appointment with coach one on one day and a different coach on another day based on what it is that you're looking for in terms of support. So our coaching profiles have tags on them around different areas of expertise of that coach, different backgrounds and life experiences. So the young person can book with the coach that best matches their needs. So it creates a lot of flexibility. The young person can do a lot of mixing and matching. And that's what they told us they wanted when we designed Soluna with them. So that's the coaching. It is available in English and in Spanish. All of these services are available in English and Spanish. And then phone coaching is available in the additional 17 Medi-Cal threshold languages in California via the addition of an interpreter to that phone call. Finally, the fourth source of support that a young person can have when they're in Soluna is our care navigation support. This is about connecting them to community resources, guided referrals, making sure that there's a seamless connection to localized support. So that's that digital front door to the rest of the system, right? So we're really upstream and we are kind of connective tissue to the rest of the behavioral health and community service system for young people. So this care navigation feature, let me talk a little bit more about it. So it is a care navigation service team, again, real humans. I want to emphasize that everything in Soluna is about human to human connection. We just happen to be doing it in a digital space. So our moderators are human, our coaches are human, our care navigators are human. And it's just a way to provide additional access to that human to human support. So our care navigation team are trained care coordinators that connect young people to needed resources from an extensive database of carefully curated resources and vetted affiliate partners to ensure that they receive the care they need when they need it. There's two bits of information that I think are really important for you to know about this care navigation feature. The first one is we take a whole person approach so that we can address all of those social determinants of health for a person. It's not just about connecting someone to a therapist or a psychiatrist. It's addressing their needs so that they can succeed and reach the goals and build that life that they want to build. So if they need housing supports or food supports or financial advice or legal supports, or transportation supports, our care navigation team can work with them to connect them to those resources in their community. And the second thing that's really important to know about our care navigation team is that they're not just handing a phone number to a young person or a website for that young person to look at independently. We are helping them book appointments. We are helping them fill out paperwork. We are doing follow-up phone calls with them. We are problem solving. If we book an appointment at a space in their community, we're helping them get there, problem solving transports, figuring out times. So it's really a concierge service to make sure that that young person doesn't get lost in the tracks, lost in the cracks, excuse me. I've sort of woven this in throughout the description of the platform and throughout the sort of development of Kooth services. We are youth-led and policy-aligned. Soluna was co-designed with young people in California to advance California's mental health ecosystem, and it directly supports the state goals for prevention, early intervention, and equitable care navigation. This is about changing the way, using a digital strategy to change the way young people access support in the 21st century in the state of California. And the only way we can do that is if we design it with young people, because it's for young people. And I like to say there's really no point in a person like me who's in their mid 40s designing this platform in the absence of youth input, because the kinds of resources and services and support that I would want and the look and the feel of the product that I would build is probably not the same as what a 15-year-old would look for. So it is absolutely imperative that we're including young people's voices as we build these services. So I'm going to talk a little bit about who our coaches are. I'm going to talk a little bit about safety. Then I've got some data for you. And then I will open the floor up for some questions. So, our coaches are certified mental health professionals. These are individuals who hold a BA or an MA in a mental health related field, and they have additional training in areas of specialty. And they fall into three buckets of certifications. So, about half of our coaches on Soluna are certified peer support specialists. So, these are individuals who bring lived experience of mental health recovery or other social challenges, and they've gone through the state certification process to learn how to deliver mental health coaching support and weave that lived experience through that and really connect with people on those shared experiences and shared backgrounds. We then have a group of mental health support professionals, general practitioners. These are experienced folks with a variety of certifications. They may or may not have lived experience, and they may or may not be weaving it into their coaching practice. We also finally have a group of substance use disorder counselors. These are individuals who are specially trained and certified in supporting youth with substance use challenges. And all of these coaches are supervised by our amazing team of licensed clinical professionals. So licensed marriage and family therapists, clinical social workers, clinical psychologists, counselors, or similar, who all hold an active state license in social work, counseling, or a related field. And these licensed folk do all the things that licensed people do in behavioral healthcare. They provide training and supervision, risk assessment, and safeguarding support, and everything in between. I've got a little hyperlink here for you in the slide if you want to go to our website and learn more about who our coaches are and how we recruit them, background checks, training, what they're doing in the room. There's some FAQs on there as well. So I encourage you to check that out and really learn about our amazing team. Let's talk about safety. This is a top priority. We know that we are serving young people who are often vulnerable, and we're doing it in an online space. And we have a very active conversation as a community right now around how we make online spaces safe. And it is an absolute top priority for us at Soluna. I've already talked about this first bullet point a little bit, which is that all user generated content is pre-moderated before going live on the platform. That's that flip of the moderation order that I talked about. We also have an anonymous model to protect service user identity, right? So they only need to give us that zip code, that date of birth, and that email address. Service users are anonymous to each other. There is no exchange of personal information possible on Soluna, and they are primarily anonymous to us. We break that anonymity glass in two scenarios. One, in the instance of a risk assessment and safeguarding scenario, we will gather the information necessary with that young person to keep them safe. And two, if they're engaging in care navigation services with our care coordinator team, we typically do need to collect some personal identifying information in order to facilitate referrals and those kind of closed loop warm handoffs. All of that information, if we are collecting it, is governed in the same way any healthcare information is governed. We are essentially a healthcare service. So we are HIPAA compliant, FERPA, COPA. We have the most conservative, stringent practices around data security and privacy. And we are subject to the same laws of confidentiality as any other healthcare service is. And we're subject to the same mandated reporting rules as well. And our service users are fully informed about all of this when they sign up as part of that terms and conditions and consent process for a service. We have robust safeguarding policies, safeguarding being managing risk like suicidal ideation, self-harm, etc. And it's built on gold standard practices in the field that many of you will already be familiar with. So at any moment that there is a sign of risk, the very first thing we do is a risk assessment to determine that level of risk. And then based on the level of risk, we follow the appropriate protocol to keep that person safe. So everything from no or low risk, which is providing resources and coping skills, connecting to coaching, building a safety plan, all the way up to imminent risk or acute crisis, where we're going to be supporting that young person in reaching crisis services so they can be safe. Service users can create a wellness and safety plan. This is rooted in the gold standard evidence-based safety plan intervention that many of us are familiar with. And they can reference that during challenging times or crises in Soluna. And finally, service users cannot directly message each other on Soluna. There's no DM function, there's no opportunity for private interactions. The only way service users can interact with each other is in that peer community forum, which of course is pre-moderated. So again, we're ensuring that any interaction, any connection between service users is safe and savory, and non-judgmental, and a true space for support. So, what I like to say when we sort of take a step back and think about the way Soluna has been designed is what we've done is we've taken all the good stuff that the internet has brought us, which is information and community. And we've excluded all the bad stuff that the internet has brought us, which is misinformation, disinformation, unsavory information, and problematic or dangerous relationships. So we know young people are going online. We know they are asking for help in certain spaces. They're going to AI chatbots, they're going to TikTok, they're going to Reddit, they're going to community forums. They're asking for help, they're asking for their questions to be answered, and they're trying to find their community. So the goal for Soluna is to be that safe, credible, trusted space for them to do that so that they can get what they need without being at risk. So now that you know what Soluna is and you understand how it came out and built out of the Kooth philosophy, let's talk about some data. So we launched Soluna in California in January 2024, and since then, Soluna has reached youth in all 58 counties in California. As of the end of February, we had over 156,000 Californian youth on Soluna, and we delivered over 56,000 coaching chats. And you can see here by this heat map on the right, the general sort of distribution of service users across the state. Um, and we know from the data that we are serving a broad range of young people in California. We're not just reaching the most privileged folks, we are reaching folks from a diverse range of backgrounds, and we are reaching folks in underserved regions as well. So 57% of our service users are from under-resourced communities, as measured by something called the Healthy Places Index, which is an index of kind of community resources based on zip code. We also know that 50% of our service users identify as a member of a Black, Indigenous, or other community of color, and 48% of users identify as a member of a Latino or Hispanic community. So, broadly reflecting the demographics of California youth overall. We also know from our data that Soluna is delivering on the promise of digital. It is meaningfully increasing access to mental health supports, and youth report it is having a positive impact on their mental health. So I'm going to walk through the first three items, data points here on the top. These data points are talking about this meaningful increase to access. 44% of our coaching sessions are happening outside of the 9 to 5 hours. That means they're happening in the evening, right? So remember that our coaching is available from 10 a.m. to 10 p.m., 7 days a week. So 44%, nearly half of our coaching sessions are being delivered in the evening, which is just showing the need for having that extension of traditional care. Most behavioral health care is provided in that 9 to 5. So by having this extension, we're increasing access, and it's clear that young people are using that increased access. When we survey our service users, 1 in 2, 50% say that they wouldn't have access to mental health support if Soluna didn't exist because of other barriers like financial or insurance or geography or stigma. And 50% of our service users report that Soluna is their first time accessing mental health services ever. So that's really an indicator that Soluna has opened this digital front door to support for youth that had either never walked through that door or couldn't walk through that door. On this bottom row of data here, we have some information about the impact, the positive impact of Soluna on service users' mental health. 86% of our returning users say that after using Soluna, they can better support someone else struggling with their mental health. So that's creating community knowledge and community support, which we know is really important for community health. 87% of our survey respondents say Soluna helped them get the support they wanted. So they came to Soluna with a particular goal, a particular question, and 87% of them are saying, I got that question answered. And then 86% of our survey respondents say they've learned they're not alone. They're not alone in feeling the way that they feel. And this is powerful. So much of the challenges around mental health is around feeling alone, feeling different, feeling not normal. And it is a very powerful effect of feeling less alone in reducing psychological distress. And that is often the power of peer-to-peer support as well. And then finally, on the right here, we have some information around how our coaching users feel about the support that Soluna gives them. 98% of coaching users would recommend Soluna to a friend. That's an enormously high number for an adolescent or young adult. Getting their recommendation, having that word of mouth is really powerful in spreading the word of a service like this. So this comes all the way back to trusted messengers. And then finally, 85% of coaching users say that they've had at least one need met during a single coaching session. So that comes all the way back to that single session model that I talked about, designing the intervention, designing that coaching model to have maximal impact with that single touch point. And we measure this with a pre and post survey. So before they go into the coaching session, they fill out a survey. It's called the Session Wants and Needs Measure. It's a research validated survey for evaluating the impact of a single session intervention. And then they say on that survey, what is it that they want? What is it they need out of this session? And then when they come out of the session, they fill out a post survey. Did I get what I want? Did I get what I needed? And 85% of individuals are saying yes, which is a really powerful endorsement of the power of a single touch point. We've also got a couple of nice quotes here. We have a beautiful testimonial library. It's my favorite Slack channel at work is our thank you Slack channel, which is where our coaches share, with permission from the service user, any gratitude or thanks or impact that Soluna has had on their life. And I just picked a couple of my favorite here. So Soluna has made an incredible positive change to my well-being. Since I started using Soluna, I have felt heard and less alone. I feel I can find some ways to be more positive with my life as a whole. It's a 14-year-old in California that's using Soluna. And then I finally felt listened to. I'm not scared to talk about my story to someone from this app because I know it's a safe space where no one would ever judge me for what I value. And that's a 16-year-old user in California. These are really powerful testimonials. The numbers speak highly of the impact of the service, but the feedback from young people themselves is particularly important for us to listen to. I'm going to pause here. In the rest of the slides, I do have some tips and tricks on how you could choose to integrate Soluna into your practice if you are providing services to young people in California. But I'm going to open up the floor to questions just to make sure we have time for that. And if we have time for me to return back to these slides, I will.
Great. Thank you so much. Amazing. Yeah. I know that there was one question in the chat. Let's
I
see.
see. Does DHCS
Yes.
or CalHope make Soluna utilization data publicly available? And then would Medi-Cal managed care plan be able to understand the extent to which its eligible members are utilizing Soluna in its counties so that we can identify opportunities to direct more of our members who could benefit but are not accessing the solution? What a great set of questions. Thank you, Sarika. The answer to the first question, is the data publicly available? Yes, in that the data that I showed you today is DHCS CalHope data about Soluna. It is publicly available. I share it on webinars like this all the time. We actually have another public webinar this afternoon for the whole initiative that Soluna is part of. It's called the Children Youth Behavioral Health Initiative, or CYBHI, which was this first in the nation sort of huge infrastructure shift of youth behavioral health access from 0 to 25. And Soluna is the digital strategy embedded in that initiative. So we have a public webinar this afternoon as well. We'll be sharing a bit more data. And we have a whole host of other data as well. In fact, I sort of teased some of that peer-reviewed research that I mentioned at the beginning. We've got a couple of papers coming out that speak to some of this additional data on Soluna since launch. So keep an eye out for that. DHCS will be putting out an alert when those are released. In terms of your managed care plans, understanding the extent, yes and no. We have a little bit of information about insurance status for our service users. We do survey our service users. That's where we get some of those data that I showed you today. And for those service users that respond, we did ask them in one of our survey rounds information about insurance. So we got a bit of a sense. It's pretty spread out. Some folks reported private insurance, some folks reported Medi-Cal, some folks reported that no, no insurance, and some folks reported that they didn't know. Lots of adolescents don't know if they're insured, or if they do know, they don't know who they're insured by. So we only have a little bit of information, and that's because, again, we're primarily anonymous service. But in terms of your question around how can we identify opportunities to direct more of your members, I would love to work with you on that. I know that managed care plans have care coordinator features, member outreach, and I would love to work with you on how we would get the message out to your members that Soluna is a resource available to them. I will do a little plug for our sibling program, Bright Life Kids, which is roughly the same kind of service, but it serves families with youth ages 0 to 12, and we serve 13 to 25. So together, Bright Life Kids and Soluna serve that 0 to 25 age range. And so I think it would be wonderful if we could come and speak to you and your team and figure out how do we engage your members so that they understand that they have access to these free resources. And also, how do we engage your provider network, making sure that they know that these resources are available to
Yeah.
them as they're working with clients.
Mm.
Um, okay, I see Claudia has a question that we always get, which is, do you have a partner organization you recommend similar to yours for adult mental health? Yes and no. So we sit inside the CalHope family of programs at DHCS, and CalHope has a handful of other services, including the CalHope Warm Line that is open to everybody for support. And there's some additional services there. So I encourage you to take a look at the CalHope website. I will say that there is no Soluna-like service in existence right now that serves over 25-year-olds. It is something that people ask about a lot. I wish I had access to something like that. So I think keep advocating and asking for it, and maybe we can develop one in time. Cassandra is saying, you mentioned that Soluna is free because it's already been paid for by the state. Is there an expected time period for how long this resource will be free for? Great question. So the current funding contract goes through 2027. And the intention of this initiative, this digital strategy, has always been to have a digital strategy as a fixture of California's behavioral health system. And so I know that the Health and Human Services Agency at the state and DHCS are already in discussions around what the next phase of funding looks like. But the goal has always been to embed Soluna and our sibling program, Bright Life Kids, into the system of care as part of that digital upstream prevention strategy. Okay, any other questions?
There's a question about scaling and
Oh, yeah.
outlook for expansion. It kind of got lost up there,
Oh, I missed it. Yeah.
into other states.
Great question. Thank you. We are already in New Jersey as an expansion, where we serve 13 to 17-year-olds. That's what the state of New Jersey was interested in providing for their community. We're in our second year there. It's going really well. I can tell you that we are working with other states across the country to bring Soluna to their communities. I can't share which ones because it's all top secret right now, but you will see Soluna expand in time. And of course, we are in the UK as well, continuing to provide services in the National
Mm.
Health Service. If you are not a California resident, if you're somewhere else in the nation, and you are interested in bringing Soluna to your state, advocate with your state representatives and see what can happen.
Hmm. Looks like there's a couple more. Um,
How do you gather and vet referral sources for social support and local mental health services? Great question, Jessica. We do it in a couple of different ways. First, we have our extensive database of already vetted resources. We've partnered with an organization called Find Help, and we have licensed a version of their database, which has this kind of curated set of statewide resources that span all of those community resources that I talked about, but also has some additional features that we have access to that allow us to facilitate closed loop referrals and warm handoffs with our partners. So that's sort of our large database of resources. But then we have developed a network of vetted affiliate partners. These are community resource partners in California that we have a kind of a close friendship relationship with. We've developed MOUs together where we essentially are able to provide digital warm handoffs together and work more closely around referrals. And so we have a vetting process there, and we make sure that our care coordinator team are really familiar with the services that provider or that group has, so that we're sending them good good fit referrals, and we make sure that they know exactly what Soluna is and what it isn't, so that they can provide that information to their clients as well. And so that vetted affiliate network partner is sort of a deeper relationship. And then of course, if we're looking for a service and we don't yet have an affiliate partner in that region or that sector, or it's not in our database, we do that research ourselves. We reach out, we find those partners, and we continue to expand that network. It's
Yeah.
important to us that those partners that we work with are able to serve the population that Soluna serves, that they can provide services in English and in Spanish, that they're actually open to taking referrals, and that their services are matching the community's needs. So that's part of the vetting.
Mhm. There's another one about, are you a CalAIM ECM provider?
Great question, Claudia. We're not, because we are at a population scale. We're not embedded inside a particular system or billing system or required framework. We kind of sit across all of the behavioral health system, and again, it's like low barrier to access. And we don't bill any insurance services. We are 100% free and no barrier. So we sort of sit across all of it, if that answers your question.
Yeah. I'm wondering, Tully, if you could maybe just speak. I know we don't have huge quantities of time, just about the youth work and just the youth ambassadors. And
Oh, yeah.
I'm also just thinking about the people who are on and maybe what's relevant for them in their work. Like, could they, I don't know if people that are on are engaging youth in a way, right, to really get their perspective. So, yeah, I'd just love to hear a little bit more.
Yeah, thank you. And thank you, Sue, for prompting me to talk about our youth ambassador program, because it's a very rich program. So we have a sort of multi channel approach to outreach and engagement with communities and service users. And that includes, we have big digital campaigns so that we're getting information in front of youth, if they're watching Disney or YouTube. But we also have an amazing community engagement team of folks out in the community and attending community events, exhibiting, tabling, going to high schools, middle schools, talking about Soluna. And then we have an incredible young adult ambassador program. These are young adults aged 18 to 25 who are Soluna users, who are engaging in community advocacy and engagement and spreading the word around Soluna and sharing their lived experience of using it. And we're on our third cohort of our Young Adult Ambassador program. If you want to find out more, we have information on our website, and I can drop the link in the chat. Let me just grab that now.
That's great.
And it's all about making sure again that we're keeping youth voice at the center. So our ambassadors are also supporting content creation. So if we come back to that self-guided resources section where we have those informational articles or quizzes, our youth ambassadors are supporting and kind of co-creating content with our content team. We have a youth advisory group that are helping us iterate the design and the kind of journey and flow of Soluna as a product. Again, it's really about making sure that youth voice are involved as we iterate both the service itself and how are we messaging that service to the community.
Mhm.
And then I think your second part, Sue, is maybe asking the audience if there are folks here that are serving this age group, transitional age youth, young adults, adolescents, and if you have thoughts around how you might want to include Soluna in your work.
Yeah. And also just the practice of what you're doing, right? Including them in the design,
Yeah,
right, of what's working in their communities. So I just think that's relevant. Oh, very good.
that's some
So,
folks to go. Yeah,
yeah.
I think, yeah, so thinking about how you involve youth, I think is such an important question for all of us as we develop services, whether they're digital or not, right? Making sure that those
Yes.
services are set up in a way that young people want to access them, right? Which means maybe non-traditional spaces. Lots of young people are talking to their athletics coach about their mental health. So maybe the access to support needs to be in those athletic spaces, not in a clinic. So kind of thinking through those innovations. I will like to finish off by just showing that we have a couple different ways that you can partner with us at no cost to you. So just thinking, Sarika, about that question around the managed healthcare plans. You can order resources from our website. If you want to promote Soluna, you can invite us to a community engagement. You can request a virtual staff training similar to what I've been doing today so that your providers, your networks are aware of this. You could become an affiliate network provider to receive closed loop
Nice.
referrals from Soluna. And if you're interested, you could also work with us to establish a bidirectional referral partnership. These are all options. There's probably some others that we can do in between. But if you are interested, just reach out to the various emails here on these slides, which we'll share after, so that you can learn more and we can work together.
Amazing. That's a lot in a short amount of time, right? I have so many more questions, but Christina is launching a poll for those who are still with us. But yes, thank you. And I think for those that are still on, we will be making the slides available. And lots of resources, right, Tully, that you have as well that
Yeah.
we will be sharing. So thank you.
Thank you, everybody.
Yes. Lots of hearts and thumbs.
We love it. We love an emoji reinforcement.
That's right. Yeah, very good.
Well, this is great poll data. Thank you, everyone.
Mhm.
It looks like everyone has responded.
Oh, good. Okay.